Hi everyone. Welcome to another lecture from my channel. I am pharmacist Dr. Izudon Wazuzu. Today, I will discuss some important topics that affects our health. Communicable and infectious diseases, vaccination and immunization. If you haven't subscribed to this channel, kindly do so now and activate the notification bell, so that you don't miss any future videos from this channel. Thanks for your support as you watch, like and share my videos, and as you subscribe to the channel as well. Now, let's go on with our topics for today. Communicable and infectious diseases. Communicable diseases are diseases that can be transmitted from one person to another and which make people sick. They are caused by infective agents known as pathogens, example bacteria and viruses, which invade the body and multiply or release toxins and cause damages to normal body cells and their functions. In severe cases, they may lead to death. These infective agents can spread from a source of infection, like patients, or sick animals, to a person through various routes of transmission. We will discuss these routes of transmission later in the lecture. Factors responsible for the spread of communicable diseases. These include 1. The infective agent, 2. The source of infection, 3. The mode of transmission, and 4. The host. These 4 factors are also known as the chain of infection. Modes of transmission of communicable diseases. 1. Contact transmission. This is disease transmission through direct body contact with an infected person. Indirectly, it can also occur through contact with objects contaminated by infective agents, like in sharing towels, combs and clothes. Examples of diseases that can be transmitted by this method include scabies, head lice, hand, foot and mouth disease, acute infectious conjunctivitis, methicillin-resistant Staphylococcus aureus, MRSA, infection, other multi-drug resistant organisms, MDROs, infection, chickenpox, scabies, etc. 2. Droplet transmission. This is disease transmission through droplets expelled during sneezing, coughing, spitting or speaking. The process is completed through subsequent touching of mucous membranes of the mouth, nose and eyes, etc. with hands contaminated with infective agents. Examples of diseases transmitted through this method include influenza, common cold, severe acute respiratory syndrome, SARS, etc. 3. Airborne transmission. This is disease transmission in which infective agents attached on small particles, or droplet nuclei, float in the air for some time and enter the body through the respiratory tract. Chickenpox and smear-positive pulmonary tuberculosis are transmitted through this method. 4. Foodborne or waterborne transmission. In this mode of disease transmission, infective agents enter the body through the ingestion of contaminated food or water, or through the use of contaminated eating utensils. Diseases transmitted through this mode include food poisoning, cholera, bacillary dysentery, hepatitis A and E, norovirus infection, etc. 5. Vector-borne transmission. Here, the infective agents either parasitize, or breed in the body of the insects, such as mosquitoes, mites, ticks, or other vectors which subsequently infect humans. Examples of diseases transmitted this way are malaria, dengue fever, Japanese encephalitis, etc. 6. Blood or body fluid transmission. This involves disease transmission through injury by contaminated needles, or sharps, or having unprotected sex. These leads to diseases like hepatitis B and C, acquired immune deficiency syndrome, AIDS, etc. Note that some communicable diseases have more than one mode of transmission, for instance chickenpox, which be transmitted through both the airborne route and the contact route. Principles of controlling communicable diseases. The control of the communicable diseases focuses on controlling the factors responsible for the spread of these diseases. The objective here is to break the chain of infection. These control measures include 1. Infective agents. The control measure here is disinfection, to kill the infective agents. 2. Source of infection. The control measures here are early detection, isolation and treatment of the sick person, and removal of breeding sites of infective agents. 3. Mode of transmission. The control measures that can disrupt the mode of disease transmission include maintenance of good personal, environmental and food hygiene, adoption of standard precautions, and additional infection control measures appropriate to different modes of disease transmission for host or susceptible population. Disease control measures that target this disease spread factor include building up personal immunity through healthy lifestyles, immunization, and prophylaxis, where appropriate. Public health strategies for controlling communicable diseases. These include 1. Preventing infection through education or prophylaxis, including immunization. 2. Minimizing transmission of infection through prompt investigation and follow-up of notifiable communicable diseases incidents, and implementation of protective measures. 3. Providing epidemiologic data for reporting and public health response measures. 4. Continuous monitoring and surveillance of communicable diseases incidents in the community to readily identify and respond to emerging illnesses or outbreaks of diseases. Methods of preventing the spread of infectious diseases. To decrease the risk of spreading infectious diseases, we recommend the following easy and practical actions. 1. Wash your hands often. This is especially important before and after preparing food, before eating, and after using the toilet. 2. Get vaccinated. Immunization can drastically reduce your chances of contracting many diseases. Keep your recommended vaccinations up to date. 3. Use antibiotics sensibly. Take antibiotics only when prescribed, unless otherwise directed, or unless you are allergic to them. Take all prescribed doses of your antibiotic, even if you begin to feel better before you have completed the medication. 4. Stay at home if you have signs and symptoms of an infection. Don't go to work or class if you're vomiting, have diarrhea, or are running a fever. 5. Be smart about food preparation. Keep counters and other kitchen surfaces clean when preparing meals. In addition, promptly refrigerate leftovers. Don't let cooked foods remain at room temperature for an extended period of time. 6. Disinfect the hot zones in your residence. These include the kitchen and bathroom. These are two rooms that can have high concentrations of bacteria and other infectious agents. 7. Practice safer sex. Use condoms. Get tested for sexually transmitted diseases, STDs, and have your partner get tested or abstain altogether. 8. Don't share personal items. Use your own toothbrush, comb, or razor blade. Avoid sharing drinking glasses or dining utensils. 9. Travel wisely. Don't fly when you're ill. With so many people confined to such a small area, you may infect other passengers in the plane, and your trip won't be comfortable, either, depending on where your travels take you. Talk to your doctor about any special immunizations you may need. Again, with a little common sense and proper precautions, one can avoid infectious diseases and avoid spreading them too. Immunization. Prevention of disease has always been considered to be more economical and effective than cure of disease. One of the most potent means of achieving this is through immunization. Immunization is considered as an important part of healthcare due to its success in controlling vaccine-preventable diseases, VPDs, worldwide. Immunization can be described as the process of making someone immune or resistant to an infectious disease. It is typically achieved by the administration of a vaccine. It is a proven tool for controlling and eliminating life-threatening diseases, like the COVID-19 virus currently ravaging most parts of the globe. The word immunity refers to the body's capacity to defend itself against a particular disease or infection. Immunization is one of the most cost-effective health investments, with proven strategies that make it accessible to even the most vulnerable populations. It is the most effective way to reduce incidence of vaccine-preventable diseases. Childhood immunization also guarantees protection from many major diseases, and according to recent studies, prevents about 2 million deaths per year worldwide. The eradication, elimination, and significant reduction of childhood vaccine-preventable diseases, as well as the extending of life expectancy in many countries, are examples of vaccination successes. Importance of vaccination. Some importance of vaccination includes: 1. Vaccination protects children from serious illness and complications of vaccine-preventable diseases. 2. Vaccination is safe, cost-effective, and easily administered. 3. Vaccination prevents spread of diseases to vulnerable populations. 4. Vaccination helps protect infants and children early in life, when they are most vulnerable to infections. Characteristics of an ideal vaccine. 1. An ideal vaccine must be highly immunogenic, so that a single vaccine dose provides a complete immunization regimen too. The recommended vaccine regimen must be highly effective in preventing disease in individual vaccine recipients, including recipients with weakened immune system, severe malnutrition, malignancies, or congenital immunodeficiency. 3. It must have a long duration of immunity, so that frequent booster doses are not needed. 4. It must be able to limit the spread of infections by preventing vaccine recipients from spreading infections to other persons. 5. It should be heat stable, so that refrigeration, that is cold chain, is not required during shipping and storage. 6. An ideal vaccine should be safely administered simultaneously with other vaccines, either as a part of a specific combination vaccine, example, measles, mumps, rubella vaccine, or as separate individual vaccines. 7. It should be technically easy to manufacture, so that it can be produced in less sophisticated settings. 8. It should be inexpensive to manufacture, distribute, and administer, so that it is affordable by the maximum number of people. Forms of immunization. Immunization could be routine, or supplemental. Routine immunization. This refers to the nationally scheduled, regular administration of vaccine doses, to infants, at specified ages. In most developing countries, it is only done on specific days of the week, to reduce vaccine wastage, since the vaccines are supplied in multi-dose vials to reduce cost. The main aim of routine immunization is to deliver a complete number of doses of potent vaccines in a timely, safe, and effective way to all children and women, by ultimately inducing immunity against targeted diseases. If this is implemented, the result is usually a drastic reduction in the burden of childhood vaccine-preventable diseases. Supplemental immunization. This is also known as immunization campaigns, and is organized occasionally by governments for the purposes of catch-up immunizations, disease eradication, and to avert epidemics. Immunization campaigns against polio and measles have yielded tremendous results globally, and in Nigeria, it has become more frequent in the last 2 decades, after WHO launched the polio eradication program. This has reduced global polio cases from 350,000 in 1988 to 1,643 in 2009, representing approximately more than 99% reduction. In Nigeria today, immunization has reduced the incidence, reoccurrence, and regeneration of childhood diseases. Universal childhood routine immunization is provided free of charge as in some other countries of the world. Data from the 2008 Nigeria Demographic Health Survey, NDHS, indicate that infant mortality rate was 75 deaths per 1,000 live births, and under 5 mortality rate was 157 per 1,000 live births. However, child mortality rate is lower in urban regions than in rural regions. Routine immunization is a key strategy in the eradication of polio program both in Nigeria and globally. Vaccines-preventable diseases. Vaccines-preventable diseases are known to account for approximately 22% of child deaths in Nigeria, amounting to over 200,000 deaths per year. However, in Nigeria as in some other third world countries, immunization coverage is low. Immunization programs in most developed nations have had dramatic success in reducing mortality and morbidity rates significantly. According to the WHO, such programs have helped in the eradication of childhood vaccine-preventable diseases since 1993. Vaccine-preventable diseases. According to the World Health Organization, the commonest childhood killer diseases are measles, tetanus, diphtheria, whooping cough, poliomyelitis, yellow fever and tuberculosis. 1. Measles. Measles remains a leading cause of death among young children, and despite the availability of a safe and effective vaccine for the past 40 years, an estimated number of 345,000 people, the majority of them being children, died from measles. The WHO estimates that almost 1 million measles-related deaths occur each year, the majority, about 85% of them, occurring in Africa and Asia. The following vaccines and treatments are available for measles disease: A. Inactivated vaccine. This vaccine was intended for use in young children, less than 1 year of age, who are predisposed to severe complications. However, it was found that at least 3 doses were needed, to derive protective antibody response, which again does not last long enough. B. Live vaccine. This type of vaccine is now frequently used. The immunity lasts for at least 10 years, or more, possibly lifelong. C. Live attenuated vaccine. The measles vaccine is contained in a combination vaccine called MMR. MMR vaccine was recommended to be given after an interval of at least 3 months, at around the usual age. 2. Poliomyelitis. Poliomyelitis is a highly contagious disease caused by 3 serotypes of poliovirus. Infection with poliovirus results in a spectrum of clinical manifestations, ranging from inapparent infection, to nonspecific febrile illness, aseptic meningitis, paralytic disease, and death. 3. Tuberculosis. Tuberculosis is an underappreciated infection, caused by the intracellular bacterial pathogen, Mycobacterium tuberculosis, and remains a major cause of mortality and morbidity in children, accounting for 10% of all TB deaths worldwide. The fundamental strategies for the prevention and control of TB include A. The early detection and treatment of patients who have active TB disease. B. Preventive therapy for infected persons, and C. Prevention of institutional transmissions. 4. Yellow fever. Yellow fever is a viral hemorrhagic fever, caused by the prototype member of the genus Flavivirus of the family Flaviviridae. It contains approximately 70 positive strands of single-stranded RNA viruses, the majority of which are transmitted by arthropods, like mosquitoes and ticks. 5. Diphtheria. Diphtheria is a Greek word meaning leather, which is an infection caused by the bacterium Corynebacterium diphtheriae. Control measures for diphtheria include A. Determining the source of infection. Whenever diphtheria is suspected or proven, B. Contact tracing should begin in the household, and usually can be limited to household members and other people with a history of direct close contact like kissing or sexual contact, sharing kitchen utensils, and people caring for children. C. Asymptomatic, previously immunized close contacts should receive a booster dose of an age-appropriate diphtheria toxoid containing the vaccine DTP, if they have not received a booster dose within 5 years. D. The following measures should be taken for close contacts, regardless of their immunization status. 1. Surveillance for 7 days, for evidence of disease. 2. Culture for diphtheria. 3. Antimicrobial prophylaxis, and oral erythromycin for 10 days. Contacts who cannot be kept under surveillance should receive penicillin G benzathine, but not erythromycin, because adherence to an oral regimen is less likely. 6. Tetanus. Tetanus is an acute, often fatal disease, caused by the exotoxin produced by the bacterium Clostridium tetani. It is characterized by generalized rigidity and convulsive spasms of skeletal muscles. 7. Pertussis. Pertussis, commonly known as whooping cough, is a respiratory illness caused by the bacterium Bordetella pertussis. This classic clinical syndrome causes morbidity by affecting the upper respiratory tract in patients of all ages. Pertussis is spread by aerosol droplets, expelled while coughing or sneezing in proximity to others. Diphtheria, tetanus and pertussis vaccine combination. Using the tetanus vaccine. In the 1930s, several scientists independently found that precipitation of the tetanus toxoid with aluminum phosphate or hydroxide yielded a vaccine that with only 2 doses induced a good response, sometimes even higher responses than the non-adsorbed plain vaccine. Childhood immunization schedule. 1. Bacillus Comet-Guerin vaccine, BCG. This vaccine is primarily used for the prevention of tuberculosis. It is named after its inventors, Albert Comet and Camille Guerin. It is given once in a lifetime, usually within 72 hours after birth, at a dose of 0.05 milliliters, injected through the intradermal route of administration. 2. Diphtheria, pertussis, tetanus, hepatitis B and Haemophilus influenza B, DPT Hep B. This is popularly known as the pentavalent vaccine. It is a class of combination vaccines developed against the above-named 5 infectious diseases in human. It is made up of diphtheria and tetanus toxoids and either attenuated whole cells of the bacterium that causes pertussis or pertussis antigens and those of the other indicated organisms. 3 doses of it are required to achieve immunity against the indicated organisms. It is administered intramuscularly at a dose of 0.5 ml at 6, 10 and 14 weeks after birth. 3. Oral polio, OPV, vaccine. This vaccine is used to prevent poliomyelitis. It is composed of weakened polyovirus and it's given by mouth. The other type of polio vaccine is the inactivated polyovirus given by injection. 3 doses of the oral polio vaccine are required to achieve immunity against polio. It is given at a dose of 0.5 ml, at 6, 10, and 14 weeks after birth. 4. Pneumococcal conjugate vaccine, PCV. This is a vaccine used to protect infants, young children, and adults from infections caused by the bacterium Streptococcus pneumonia. 3 doses of it are required to achieve immunity. It is administered by intramuscular injection at a dose of 0.5 ml, at 6 weeks, 10 weeks, and 9 months after birth. 5. Injectable polio vaccine, IPV. As mentioned earlier, this is made up of inactivated polyovirus and is used to prevent poliomyelitis. It's given by intramuscular injection, once in a lifetime, to augment the oral polio vaccine. It is given at a dose of 0.5 ml, and at 14 weeks of birth. 6. Measles mumps rubella, MMR, vaccine. This vaccine was developed to protect against measles, mumps, and rubella infections. 2 doses are usually required to achieve immunity against the indicated organisms. It is administered at about 12 months after birth, and at between 15 months to 6 years of age, with at least 4 weeks between the 2 doses. A dose of 0.5 ml administered by subcutaneous injection is usually given. 7. Tetanus diphtheria, TD, vaccine. This is administered to the woman as soon as pregnancy is known to protect the infant from the indicated infections, especially during the period from birth to the time the child is due for his own vaccination against these infections. 2 doses, given at least 1 month apart, are required to achieve immunity. A dose of 0.5 ml given by intramuscular injection is usually applied. Adult immunization Schedule 1. Influenza vaccine. 1 dose of this vaccine annually is recommended. 2. Tetanus, diphtheria, pertussis vaccine, TD-PDAP. It is currently recommended that you substitute the one-time dose of PDAP for TD booster, then boost with TD every 10 years. 3. Varicella vaccine. 2 doses of this vaccine are required to achieve immunity against the varicella organism. 4. Human papillomavirus vaccine, HPV. Female. 3 doses of this vaccine are required to achieve immunity against the virus in females. 5. Human papillomavirus vaccine, HPV. Male. 3 doses of this vaccine are required to achieve immunity against the virus in males, if risk factor present. 6. Zoster vaccine. 1 dose of this vaccine is required for adequate immunity. 7. Measles, mumps, rubella vaccine, MMR. 1 or 2 doses of this vaccine are required for adequate immunity. 8. Pneumococcal pentavalent conjugate vaccine, PCV13. 1 dose of this vaccine is required for adequate immunity. 9. Pneumococcal polysaccharide vaccine, PPSV23. 1 or 2 doses of this vaccine are required for adequate immunity. 10. Meningococcal vaccine. 1 or more doses of this vaccine are required for adequate immunity. 11. Hepatitis A vaccine. 2 doses of this vaccine are required for adequate immunity. 12. Hepatitis B vaccine. 3 doses of this vaccine are required for adequate immunity. 13. Haemophilus influenzae type B vaccine. HID. 1 to 3 doses of this vaccine are required for adequate immunity. Methods of vaccine administration. 1. Intramuscular, IM, injection. This administers the vaccine into the muscle mass. Vaccines containing adjuvants should be injected IM. To reduce adverse local effects, injectable immunobiologics should be administered where local, neural, vascular, or tissue injury is unlikely. Use of longer needles has been associated with less redness or swelling than occurs with shorter needles, because of injection into deeper muscle mass. Appropriate needle length depends on age and body mass. Appropriate injection technique is the most important factor that ensures efficient intramuscular vaccine delivery. 2. Subcutaneous, SC, injection. This administers the vaccine into the subcutaneous layer, above the muscle, and below the skin. 3. Intradermal, injection. Here vaccines are administered in the topmost layer of the skin. BCG is the only vaccine with this route of administration. Intradermal injection of BCG vaccine reduces the risk of neurovascular injury. Health professionals often claim that BCG is the most difficult vaccine to administer, due to the small size of newborns' arms. 4. Oral administration. This method of vaccine administration makes immunization easier, by eliminating the need for a needle and syringe. Rotavirus, adenovirus, cholera vaccine, and oral polio vaccines are the only vaccines administered orally. 5. Intranasal spray application. This method offers a needle-free approach of vaccine administration, through the nasal mucosa of the nose. 6. Multiple injections. If multiple vaccines are to be administered at a single hospital visit, each vaccine preparation should be administered at a different anatomical site. The location of all injection sites, with the corresponding vaccine injected, should be documented in each patient's medical record. Vaccine storage. Vaccines must be stored and transported within the required temperature range of +2°E to +8°E at all times. This is popularly known as cold chain handling. Most vaccines are considered to be damaged at 0 degrees Celsius. Frozen or damaged vaccine may not visually appear solid or change in appearance. However, different vaccines have different storage temperature requirements. Failure to adhere to cold chain requirements may reduce vaccine potency, resulting in lack of protection against vaccine-preventable diseases, or increased local reactions after administration of vaccine. The loss of vaccine effectiveness, due to exposures to adverse conditions, is usually cumulative, permanent and irreversible. Therefore, efforts must be made to store vaccines appropriately. Domestic or bar commercial refrigerators are not recommended for vaccine storage. It is complicated to manage domestic and commercial refrigerators for vaccine storage. The cold chain. The cold chain is the name given to the system of transportation and storage of vaccines, which maintains the recommended temperature range of between +2 degrees Celsius to +8 degrees Celsius. It is essential to maintain an unbroken cold chain, from the point of vaccine manufacture, through transportation, to distribution companies, storage in refrigerators in pharmacies, and transport to clinical settings, where vaccines are stored in refrigerators until they are used. Heat speeds up the decline in potency of most vaccines. Freezing of vaccines can also cause loss of vaccine effectiveness, increased reactogenicity, and hairline cracks in the container, the latter leading to contamination of the contents. Effectiveness cannot be guaranteed for vaccines, unless they have been transported and stored at the correct temperatures. Importance of the cold chain. 1. Vaccines are sensitive biological substances that can lose their potency and effectiveness if they are exposed to temperatures, that is heat or cold, outside the required temperature range of +2 degrees Celsius to +8 degrees Celsius, or when exposed to sunlight. 2. Freezing refers to a situation where vaccines experience temperatures at or below 0 degrees Celsius. Vaccines may not appear frozen but may have been damaged at these temperatures. Most vaccines are considered to be damaged at 0 degrees Celsius. 3. Failure to adhere to cold chain requirements may reduce vaccine potency, resulting in lack of protection against vaccine-preventable diseases, or increased local reactions after administration of vaccine. 4. The loss of vaccine effectiveness, due to cold chain exposures to adverse conditions, is cumulative, permanent and irreversible. 5. Individuals who are immunized with exposed vaccines often need to be recalled by their health care providers and re-immunized to ensure that they are protected against the specific vaccine-preventable disease or diseases. 6. Vaccines may have been wasted if they have been exposed to temperatures below +2 degrees Celsius or above +8 degrees Celsius, or if they are not used prior to the expiry date. 7. Vaccine wastage results in increased costs in terms of replacing the wasted vaccines, cost of human services, and cost of specialized transportation. 8. With the globalization of the vaccine manufacturing industry, and intermittent global vaccine shortages, it is not always possible, or easy to quickly obtain additional quantities of vaccines, to replace vaccine that is wasted. Definition of vaccine-related terms. 1. Exposed vaccine. Vaccine that is stored or handled at temperatures below +2 degrees Celsius or above +8 degrees Celsius. Coronavirus disease 19. COVID-19. Introduction. The coronavirus disease 19. COVID-19 is a highly transmittable and pathogenic viral infection caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which caused a global pandemic in 2019 that led to a dramatic loss of human lives worldwide. Genetic studies have shown that SARS-CoV-2 is related to severe acute respiratory syndrome, that is SARS-like bat viruses. Therefore bats could be the possible primary reservoir. The intermediate source or origin and transfer to humans is not known. However, the rapid human-to-human transfer has been confirmed widely. There is no clinically approved antiviral drug or vaccine available to be used against COVID-19. However, a few broad-spectrum antiviral drugs which have been evaluated against COVID-19 in clinical trials have resulted in clinical recovery. Coronaviruses were first identified in the 1960s. Almost everyone gets a coronavirus infection, at least once in their life, most likely as a young child. In the United States, regular coronaviruses are more common in the fall and winter, but anyone can come down with a coronavirus infection at any time. The symptoms of most coronaviruses are similar to any other upper respiratory infection, including a runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as a rhinovirus. You treat this kind of coronavirus infection the same way you treat a cold. Previous coronavirus outbreaks. 1. Middle East Respiratory Syndrome, MERS. About 858 people have died from MERS, which first appeared in Saudi Arabia and then in other countries in the Middle East, Africa, Asia, and Europe. In April 2014, the first American was hospitalized for MERS in Indiana, and another case was reported in Florida. Both had just returned from Saudi Arabia. In May 2015, there was an outbreak of MERS in South Korea, which was the largest outbreak outside of the Arabian Peninsula. 2. Severe acute respiratory syndrome, SARS. In 2003, 774 people died from an outbreak. As of 2015, there were no further reports of cases of SARS. Symptoms of COVID-19. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. The most common symptoms are fever, cough, tiredness, loss of taste or smell. The less common symptoms include sore throat, headache, aches, and pains, diarrhea, rash on skin, or discoloration of fingers or toes, red or irritated eyes. Serious symptoms of COVID-19 are difficulty in breathing, or shortness of breath, loss of speech, or mobility, or confusion, chest pain. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms, who are otherwise healthy, should manage their symptoms at home. On the average, it takes about 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Prevention of COVID-19. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads. Protect yourself and others from the infection by staying at least 1 meter apart from others, wearing a properly fitted mask, and washing your hands, or using an alcohol-based rub frequently. Get vaccinated when it's your turn, and follow local guidance. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. for example, by coughing into a flexed elbow, and to stay home, and self-isolate until you recover, if you feel unwell. Additional guidelines for preventing infection, and slowing transmission of COVID-19, includes the following. Get vaccinated, when a vaccine is available to you. Stay at least 1 meter apart from others, even if they don't appear to be sick. Wear a properly fitted mask, when physical distancing is not possible, or when staying in poorly ventilated settings. Choose open, well-ventilated spaces, over closed ones. Open a window if indoors. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rub. Cover your mouth and nose, when coughing or sneezing. If you feel unwell, stay at home and self-isolate until you recover. It's important to note that most coronaviruses aren't dangerous. In early 2020, after a December 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 as a new type of coronavirus. The outbreak quickly spread around the world. COVID-19 can trigger respiratory tract infection. It can affect your upper respiratory tract, that is the sinuses, nose, and throat, or lower respiratory tract, which includes the windpipe, and the lungs. It spreads the same way other coronaviruses do, mainly through person-to-person contact. Infections range from mild to deadly. SARS-CoV-2 is one of 7 types of coronavirus, including the ones that cause severe diseases like Middle East Respiratory Syndrome, MERS, and Sudden Acute Respiratory Syndrome, SARS. The other coronaviruses cause most of the colds that affect us during the year but aren't a serious threat for otherwise healthy people. COVID-19 variants. Viruses usually change, or mutate, as they infect people, and the COVID-19 virus has also done so. There are several variants that are now spreading, some proving to be more contagious as well as more deadly than the original virus. These include 1. The Alpha variant 2, the Beta variant 3, the Gamma variant 4, the Delta variant 5, the Omicron variant 6, the Lambda variant 7, the Mu variant 8, the Deltacron variant, which was hypothesized in the first week of January 2022, as a fusion of the Delta variant with the Omicron variant. I will update you with the latest information on this Deltacron in subsequent videos. Ensure you are subscribed to this channel, with the notification icon activated, so that you don't miss any video from the channel. COVID-19 risk factors. Anyone can get COVID-19, and most infections are mild. The older you are, the higher your risk of severe illness. You also have a higher chance of serious illness, if you have one of these health conditions. 1. Chronic kidney disease. 2. Chronic obstructive pulmonary disease, COPD. 3. A weakened immune system, due to an organ transplant. 4. Obesity. 5. Serious heart conditions, such as heart failure, or coronary artery disease. 6. Sickle cell disease. 7. Type 2 diabetes. Some conditions can also lead to severe COVID-19 illness, and they include 1. Moderate to severe asthma. 2. Diseases that affect your blood vessels, and blood flow to your brain. 3. Cystic fibrosis. 4. High blood pressure. 5. A weakened immune system, because of a blood or bone marrow transplant, HIV, or medications like corticosteroids. 6. Dementia. 7. Liver disease. 8. Pregnancy. 9. Damaged, or scarred lung tissue, that is pulmonary fibrosis. 10. Smoking. 11. Thalassemia. 12. Type 1 diabetes. 13. Depression. 14. Anxiety. 15. Schizophrenia. Persons suffering from these conditions must be extremely careful with their health, so as to avoid contracting COVID-19, as it may be fatal for them. Now, some children and teenagers, who are in the hospital with COVID-19, have been observed to have an inflammatory condition, which physicians are calling multi-system inflammatory syndrome in children. These physicians think it may be linked to the virus. It causes symptoms similar to those of toxic shock, and of Kawasaki disease, a condition that causes inflammation in kids' blood vessels. COVID-19 transmission. Coronavirus spreads mainly from person to person. People release respiratory fluids during exhalation. Example: quiet breathing, speaking, singing, exercise, coughing, Sneezing. In the form of droplets across a spectrum of sizes, these droplets carry viruses and transmit infection. The largest droplets settle out of the air rapidly, within seconds to minutes. The smallest very fine droplets, and aerosol particles formed when these fine droplets rapidly dry, are small enough that they can remain suspended in the air for minutes to hours. Risk of transmission is greatest within 3 to 6 feet of an infectious source, where the concentration of these very fine droplets and particles is greatest. If you breathe them in or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can still spread the virus. While less likely, you can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. Most viruses can live for several hours on a surface that they land on. A study shows that SARS-CoV-2 can last for several hours on various types of surfaces. For example, 1. Copper surfaces, like pennies, tea kettles, cookware, 4 hours. 2. Cardboard surfaces, like shipping boxes, up to 24 hours. 3. Plastic surfaces, like milk containers, detergent bottles, subway and bus seats, elevator buttons, 2 to 3 days. 4. Stainless steel surfaces, like refrigerators, pots and pans, sinks, some water bottles, 2 to 3 days. That's why it's important to wash or sanitize your hands regularly and disinfect surfaces to get rid of the virus. Again, some dogs and cats have tested positive for COVID-19. A few have shown signs of illness. There's no evidence that humans can contract coronavirus from an animal, but it appears it can be passed from humans to animals. Community spread of COVID-19. Physicians, pharmacists and other health professionals use this term when they don't know the source of the infection. With COVID-19, it usually refers to someone who gets the virus, even though they haven't been out of the country, or haven't been exposed to someone who traveled abroad, or who has COVID-19. For instance, in February 2020, the CDC confirmed a COVID-19 infection in California, in a person who had not traveled to an affected area, and not been exposed to someone with the disease. This marked the first instance of community spread in the US. It's likely that the person was exposed to someone who was infected, but didn't know it. This type of occurrence has been happening with the new variants as well. Transmission speed. The number of people infected by SARS-CoV-2 changes every day. The transmission rate is relatively high. Early research has estimated that one person who has it can spread it to between 2 and 4 others. One study found that the rate was higher, with one case spreading to between 5 and 7 other people. By comparison, one person who has the seasonal flu will pass it to between 1 and 2 others. The Omicron variant, which is now the dominant strain of COVID-19 in the world, is highly contagious and will likely spread faster than the original virus. Scientists are still looking into how easily Omicron spreads compared to the previous dominant Delta variant. The CDC expects that someone who's infected with Omicron can spread it to other people, even if the infected person is vaccinated or doesn't have symptoms. The CDC also reports that there is evidence that COVID-19 can be transmitted if you get within 6 feet of someone who is infectious, for a total of 15 minutes throughout a day. It had previously been believed that the exposure had to be 15 minutes at a time. We can work to lower the transmission rate by wearing cloth face masks when we can't stay 6 feet away from others, washing hands often, keeping common surfaces clean, limiting contact with other people, and getting vaccinated. Transmission media. One is much more likely to get COVID-19 from another person than from packages, groceries, or food. If you're in a high-risk group, stay home, and use a delivery service, or have a friend shop for you. Have them leave the items outside your front door, if you can. If you do your own shopping, wear a cloth face mask, and try to stay at least 6 feet away from other shoppers. Wash your hands for at least 20 seconds before and after bringing things into your home. The coronavirus can linger on hard surfaces, so clean and disinfect countertops and anything else your bags have touched. You can wipe down plastic, metal, or glass packaging with soap and water if you want. However, there is no evidence that anyone has gotten COVID-19 from food or food containers. COVID-19 diagnosis. COVID-19 may be diagnosed with the presence of exposure and symptoms like 1. Fever of about 100 F or higher. 2. Cough. 3. Trouble breathing. Testing facilities are readily available in most areas. While some require an appointment, others are simply drive up. Home testing kits are also widely available. A swab test is the most common testing method. It looks for signs of the virus in your upper respiratory tract. You're the person giving the test. Puts a swab up your nose to get a sample from the back of your nose and throat. That sample usually goes to a lab that looks for viral materials, but some areas may have rapid tests that give results in as little as 15 minutes. If there are signs of the virus, the test is positive. A negative test could mean there is no virus, or there wasn't enough to measure. This can happen early in an infection. It usually takes 24 hours to get results, but the tests must be collected, stored, shipped to a lab, and processed. The FDA granted emergency use authorizations for tests that include home nasal swab tests, which you collect yourself, and send back to the lab for analysis. The agency also approved several at-home rapid tests. You can buy these over the counter in pharmacies, at retail stores, or online, but kits that give you rapid results, within minutes, can sometimes be hard to find due to high demand. At-home tests are also available for free at some local health departments, or federally qualified health centers. A swab test can only tell whether you have the virus in your body at that moment, but you may also consider taking an antibody test which can show whether you've ever been exposed to the virus, even if you didn't have symptoms. This is important in official efforts to learn how widespread COVID-19 is. In time, it might also help them figure out who's immune to the virus. The FDA is working with laboratories across the world to develop more tests. COVID-19 prevention. Getting vaccinated against COVID-19 is a key part of prevention, but you should also take these steps. 1. Cover your nose and mouth in public. If you have COVID-19, you can spread it even if you don't feel sick. Wear a mask to protect others. This isn't a replacement for social distancing. You still need to keep a 6 feet distance between yourself and those around you. Don't use a face mask meant for healthcare workers. And don't put a face mask covering on anyone who is under 2 years old, someone having trouble breathing, or someone who is unconscious, or can't remove the mask on their own for other reasons. 2. Wash your hands often with soap and water, or clean them with an alcohol-based sanitizer. This kills viruses on your hands. 3. Don't touch your face. Coronaviruses can live on surfaces you touch for several hours. If they get on your hands and you touch your eyes, nose, or mouth, they can get into your body. 4. Practice social distancing. Because you can have and spread the virus without knowing it, you should stay home as much as possible. If you do have to go out, stay at least 6 feet away from others. 5. Clean and disinfect. You can clean first with soap and water, but disinfect surfaces you touch often, like tables, doorknobs, light switches, toilets, faucets, and sinks. Use a mix of household bleach and water, example 1/3 cup bleach per gallon of water, or 4 teaspoons bleach per quart of water, or a household cleaner that's approved to treat SARS-CoV-2. You can check the Environmental Protection Agency, EPA, website, to see if yours made the list. Wear gloves when you clean, and throw them away when you're done. My personal and professional experiences shows me that herbal therapies and teas can prevent COVID-19 infection, but this is solely my opinion as pharmacist Azudonwe Ozuzu, not as a scientist yet, at least, till I publish my experiences and findings. COVID-19 preparation guidelines. In addition to practicing the prevention tips listed above, you can also do the following. 1. Meet as a household, or larger family, to talk about who needs what. 2. If you have people at a higher risk, ask their doctor what to do. 3. Talk to your neighbors about emergency planning. Join your neighborhood chat group, or website to stay in touch. 4. Find community aid organizations that can help with health care, food delivery, and other supplies. 5. Make an emergency contact list. Include family, friends, neighbors, carpool drivers, doctors, teachers, employers, and the local health department. 6. Choose a room, or rooms, where you can keep someone who is sick, or who's been exposed. separate from the rest of you. 7. Talk to your child's school about keeping up with assignments. 8. Set yourself up to work from home, if your office is closed. 9. Reach out to friends or family, if you live alone. Make plans for them to check on you by phone, email, or video chat. Use of face masks. A mask is an added layer of protection for everyone. On top of vaccines and social distancing efforts, you can spread the virus when you talk or cough, even if you don't know that you have it or if you aren't showing signs of infection. It's important to wear a mask in a variety of situations. If you're fully vaccinated, wear a mask in public places if you're in an area where there's a high or substantial amount of COVID-19 spreading around. If you aren't fully vaccinated, always wear a mask in indoor public places. This goes for people 2 years old and up. If you have a chronic health condition, or you're taking medicines that weaken your immune system, wear a mask in indoor public places, even if you're fully vaccinated. Do this unless your doctor tells you otherwise. In general, you don't need to wear a mask outside, where it's harder for the coronavirus to spread. But if COVID-19 cases are high in your area, consider wearing one in crowded outdoor places, and for outdoor get-togethers that involve close contact with people who aren't fully vaccinated. Everyone should wear a face mask if they are sick and around other people or animals, even at home. Caregivers should use them when cleaning and disinfecting a sick person's bedroom or bathroom. If you need to call 911, put on a mask before medical help arrives. Some people who shouldn't wear masks includes 1. Kids under 2 years old. 2. Someone with a disability who can't wear a mask or can't safely wear one due to the disability. 3. A person who has a job in which wearing a mask would create a risk to his co-workers' health or safety, as determined by the Workplace Risk Assessment. Types of face masks. These includes 1. Cloth masks. These are washable and reusable. The best ones have multiple layers of breathable fabric and fit snugly over your nose and mouth. It's a good idea to buy ones that come with a nose wire. Thank you for listening and God bless you. The script of this lecture is also available in the description of this video below. Feel free to check it out. We hope you learned something from this lecture. If you did, kindly like and share this video. Also support this channel by clicking the subscribe button, as well as the bell button beside it, and select all from the options. That way, you will be notified of any other video we publish on this channel. Remember that this is a computer-modified audio version of this video, made to ensure that our audience in different parts of the world can hear and understand the lectures. Till we come to you again with another interesting video, keep staying safe. Get vaccinated now. Wear your nose and mouth masks. Wash your hands frequently and maintain physical and social distances. Bye for now, and see you in the next video.